and welcome. I'm Maloni Bhatt, and this is a special conversation with a member of the jury of the ZS Prize. ZS is a management consulting and technology firm focused on transforming global healthcare and beyond. The ZS Prize, instituted by the company, aims to nurture ideas that can solve some of the complex challenges of healthcare access and affordability in India at scale. And today I'm very happy to welcome Vinita Bali. She's a global business leader and former MD of Britannia, and she's also been part of the top management of Cadbury Schweppes and the Coca-Cola Company. She is an independent director now on many boards in India and abroad. Vinita, what a pleasure to have you here with us today.
Thank you, Maloni. Great to be here with you.
You know, you were among the 27 global leaders appointed by the UN in 2012 to help improve maternal and child health as part of the Scaling Up Nutrition Initiative. You directed efforts towards the issue of nutrition while at Britannia and as chair of the Global Alliance for Improved Nutrition. And you've been on the boards of healthcare and food and agri-product companies. Now, India has many healthcare challenges, and solving for them is one of the themes of the ZS Prize. From your vantage, what are India's most pressing healthcare challenges?
It's a big question, Maloni, and I think where I would like to start is to say, what is our definition of healthcare? Actually, if I think about it, healthcare is actually sick care, because we start addressing the challenges and the problems of health when people are unwell. So if we have to turn it on its head and say, how do we create an environment in India where, we move really to the whole concept of healthcare and away from what I'm at least calling sick care? Several things have to happen. And those include, access to medical facilities within a certain radius from where I live. So I'm not necessarily talking about our cities and towns, but for example, our villages. We do have the concept of primary healthcare centers. So if you think about it from a structure point of view, yes, we are supposed to have the primary healthcare centers, and there are the ASHA workers, and all of that together is the system that is geared to deliver. But there are several inadequacies in that system, which have to be addressed both from a structure point of view, which is, what is the hardware that is available, and also from a process point of view. And that's why the ZS Healthcare Awards and the innovations make so much sense to me. The question we have to ask is, what do we need to do to provide a decent quality of healthcare to 1.4 billion Indians? And the answer is not easy. So, so it has to be tackled at the medical level. Equally importantly, what I have learned is that has to be tackled at the nutrition level, because a lot of the lifestyle diseases, all the NCDs that we see, really have to do with access and availability and knowledge of nutritious food. There are other things like the availability of potable water, the availability of primary health care, close to where people live. So there are structural issues and there are systemic issues, but there are also issues of how do we train a workforce to deal with the basic healthcare issues, at the primary care center level, so that secondary and tertiary care becomes less necessary if things are treated at the primary care level.
And how do you see businesses, whether big, whether small, play a more impactful role in addressing some of these challenges?
There are different businesses. So there are businesses that are in the business of healthcare. There are other businesses who, as part of their CSR efforts, are running various programs that have to do with, access to medical facilities, public-private partnerships, and so on. Clearly, everything that we are doing is not enough, because the health status of India is really not good. When you look at it in terms of undernutrition, malnutrition, when you look at, just take a simple thing like iron deficiency anemia, more than 50% of Indian women have a deficiency. More than 60% of school-going children are anemic. So all of this impact everyday healthcare. They impact, everyday well-being. And this is just one. I've just picked up, iron as a deficiency. There are so many other nutrients. So I think unless we look at the issue holistically and tackle it from every point of view, and it's a big task. The good news is that we've got the basic structures to address this. So what do I mean by that? We've talked about the primary healthcare centers. We've got about 1.4 million Anganwadis, which were created to cater to the health needs, which is food as well as micronutrients of pregnant and nursing women and children 0 to 6 years. Then we've got the midday meal scheme, which caters to 120 million kids every day in school. So if we simply were to make these work better, either through the companies whose business food and healthcare is, or through other companies who are looking at providing some or all of this as part of their CSR program, and dealing with it like we would deal with any other business initiative. Put your best resources behind it, create the metrics to determine what progress has been made, and hold people accountable for delivering results, not just for the effort they put in.
You mentioned malnutrition and undernutrition, which is a very sad reality in India, and it's often intergenerational. But you were deeply engaged in addressing this issue, from your time at Britannia. How did you go about, sort of setting out, as you pointed out, maybe the processes, the structures, and in creating impact? If you could, tell us a bit about that.
So we did it in various ways, keeping in mind what our core competencies were. So there were things we could directly do, and there were things that we could directly influence, but not directly do. So what were some of the things that we could directly do that came out of a very simple and basic insight? We know the statistics on stunting, wasting, etc. Almost 42% of India's children are either underweight or stunted or wasted. And we also realized that biscuits was something that had a very high penetration amongst households, whether it was urban India or rural India or whatever. We took some inspiration or guidance, if I could use that word, from the success that India had had with iodine fortification in salt. So we now have almost universal iodization in salt. And we looked at data available from many countries around the world that has excellent evidence to say that with micronutrient fortification in food, you can begin to address in a significant way, not holistically, in a significant way, some of the micronutrient deficiencies. So that's what we created. We initially worked, our study partners were the All India Institute of Medical Sciences. We worked in schools, we did longitudinal studies. We looked at the anthropometric measures of these children, height, weight, etc. We then worked with, the pediatricians who actually determined that, these children would require 15 milligrams or 20 milligrams of iron every day. And we created our products. We created Tiger biscuits, where each biscuit, let's say, would have 5 milligrams. So if I wanted to give 15, 3 biscuits were given to you, or 4 biscuits were given to you, and so on. And then we studied all of this at the end of 90 to 100 days and even later. And what we found was astounding. If you take the average level of hemoglobin, which is the easiest measure of iron, there are more complex measures as well. We're talking about children coming to school with average levels, average level was between 8.5 and 9. And with 100 days of actually giving micronutrient fortified biscuits to these children, that level of hemoglobin went up between 12 to 12.5, which is a fantastic outcome, just with one variable that has changed. So the kids were still getting the hot cooked meal in school, we added this as a snack, 2 biscuits in the morning, 2 biscuits in the afternoon. And it is a very, very simple way of actually ensuring that each time you have a biscuit, you have some of the micronutrients that you are imbibing. We also did bioavailability studies on these and, convinced ourselves, in addition to all the evidence available from around the world, that micronutrient fortification is but one, but of the many ways or the many initiatives that need to be taken to address undernutrition or malnutrition. Of course, there are other things. If I'm not getting enough calories to eat, it doesn't matter, what else I'm getting. So there has to be a base level of macronutrients, which is the calories you're getting, then the vitamins and minerals to add to this. And a lot of this, delivered either through food itself or supplementation or fortification. And today, there is very good work that is being done on biofortification. So in other words, I don't need to add, something to the product I'm selling. The wheat that is grown or the rice that is grown is already fortified with vitamins and minerals.
Right, this is very, very interesting, something that a company could intervene in and actually see positive impact,
Absolutely.
Just by sort of looking at it holistically and, seeing where they could contribute. And this is very, very interesting. But, there have been so many advances now, right? Like with AI, ML, robotics, and they're transforming so many sectors. When you look at technology, how do you see that improving, say, patient outcomes and overall efficiency in the Indian healthcare sector? And, any particular technology that you would, say from your vantage that looks particularly exciting to you, when it comes to intervention in managing healthcare challenges in India?
I really think that when it comes to healthcare, if we can deploy technology at the first foundational level, that is going to be great. And there have been, enhancements and improvements. For example, you can today, just yesterday I was out looking at the work of one of the companies I'm engaged with in the healthcare space. And one of the things that they've got is a kit that, a trained nurse or a medical practitioner can take to your home. And it has, it takes your blood pressure, it does an ECG, all of that is done remotely and in your home. There aren't enough of these available, which is why, healthcare is still such a big issue. So I think if we were to start this questioning in terms of where is the innovation most needed? Part of what I have seen is innovation is most needed in a decentralized way where the problem arises, where you can go into a village and, quickly test whether it is women or children or whatever. Now, we do have these structures of Anganwadi centers. We do have the primary healthcare centers and so on. So what are some of the things that can very quickly be tested, not necessarily by doctors, but by trained nurse practitioners? In the US has a system where they call paramedicals. So I'm not a doctor, but I am trained and skilled enough to be able to check some of the basic parameters that are key to determining, the right diagnosis later. We heard a lot about telemedicine, and if it is working, then part of our challenge always is how do we scale up something that is already working? So if telemedicine combined with a nurse practitioner who can take my vital statistics, connect me to a doctor, ranging all the way from a GP to a specialist, then we can ensure that the diagnosis is done adequately, it is done on time, and the right kind of care is then available to the patient. Part of the issue, and therefore I think along that chain, it would be very, very important for companies who are in that business to identify where the intervention will have the highest value from an outcome point of view, and that outcome is only one outcome, which is better healthcare for the patient.
We want to move towards some of the questions, linked to the ZS Prize. What attracted you to, being part of the jury of ZS? And, when it comes to impact, what are you hoping to see?
It's very clear. I mean, I got into the whole area of nutrition and healthcare through my business engagement with food product companies. And I realized how much needs to be done. And therefore, I also realized that it's not just the effort of pharma companies or medical companies or food companies. This requires the comprehensive effort of, the whole ecosystem, from what we grow, where we grow it, what price we sell it at, how it gets marketed to consumers, what are the formulations, what are the regulatory practices, how do we make it affordable and accessible, and so on. So it is the larger ecosystem. And, since these prizes are, not these prizes, this initiative is directed at attracting innovation in healthcare. I'm told we've got over 33,000 people participating, over 2,800 entries, and so on. I was curious to know where some of this innovation is taking us. And equally importantly, if we were to fund the right kind of innovation, which is part of the remit of the ZS Prize, if we were to fund the right kind of innovation and help to scale it up, imagine the difference you can make in the healthcare and well-being space. So, that's what attracted me.
Yeah, it's also interesting. I mean, the number of entries first, and the fact that, they're all innovations in the healthcare space, innovations, hopefully, not hopefully, but innovations that are emerging for India and hopefully may go on, to solve for the world. Any advice, and this is my last question to you, any advice for aspiring participants?
The only thing I would say is, let's look at an innovation that I would call is relevant and differentiated. So it has to be a meaningful innovation. It can't be yet another app to solve something which we already have an app for. So it has to be distinctive. It has to really be relevant and meaningful, in the sense that if the innovators could help identify what is the problem they identified, to which the innovation is a possible solution, and why would it matter? I think that would be very helpful. So it's not that, we can innovate along many dimensions and scales, but every innovation is not necessarily a differentiator or a value creator. And therefore, my request or direction to the innovators is, tell us the problem you're trying to solve. Tell us how your innovation will help solve that problem. Tell us how it will be better than current solutions that exist, if current solutions exist. And also tell us what is involved in scaling this up.
Right. So a differentiated innovation, with a very clear value proposition, and hopefully you will see some of those, as member of the jury. Vinita Bali, it's been wonderful speaking to you. Thank you so very much for sharing your views on so many aspects of healthcare. Thank you very much for your time today.
Thank you very much. I appreciate it, and I look forward to seeing the many wonderful innovations.